And welcome back. I am now joined to talk policy and some politics, but mostly policy, with Cindy Gillespie. She's the Executive Director of the Arkansas Department of Human Services. Welcome back to the program.
Thank you, Roby. I'm happy to be here.
I trust we're still treating you well here in Arkansas.
I still love it. It's still a great place to be.
Good.
Even become a Razorback fan.
All right. I like to hear that. I like to hear that. Of course, the Bulldogs had a bad season this year, so it was a little rough around the edges. Let's begin with some what I consider some very heart-wrenching, heartbreaking news this past week, and this is something you deal with on a daily basis, but it was highlighted this week. There was a report before the legislature that there are more than 10,000 Arkansas children who have been maltreated at home in the last year, the last 12 months, the last fiscal year. What's at the root of this problem? Are we talking about bad parents? Are we talking about bad foster parents? Are we talking about foster kids hurting foster kids? What's at the root of all of this?
I don't think anyone can tell you that there's any single thing that's at the root of what's going on. Whenever you have issues like this in society, it's going to be multi-factor. There's not one silver bullet that fixes everything. What we've been trying to do at DHS, as I think you know, we have had an enormous increase in the number of children that we've been bringing in foster care in the last year. And so we've been really trying to look to see what's causing that, what we can do to try to ensure that we, in some way, we've started talking about it as a crisis, that we in some way address the crisis. So we started, as you probably heard, back in May with meetings 3 times a week, usually for several hours each time. We started calling it Foster Care War Room, really trying to take a deep dive and understand what was going on.
So you do have a lack of enough caseworkers to manage some of the cases there. That obviously allows some things to fall through the cracks. What are some of the other symptomatic things that are driving this crisis?
Quite a few elements going on. One big issue for us in this state is that we have not had a focus on the biological families. We've focused on the children, which is the priority, but you also have to focus on the family that the child is, the home that the child is in, and see if you can work with that family. Is there a way to, in some way, keep the child in the home yet safe? How do you get the services to the family? How do you focus on ensuring that there is a plan to get the family as healthy as possible and return the child as quickly as possible? Those are very important elements that we really haven't had a focus on here in Arkansas. So a large part of what we want to do is really focus on what we call strengthening families. A big piece of that is also to be able to have better access to behavioral health services. We don't have the substance abuse and behavioral health services available in the state that we need, both for those families as well as for the children. So another big area of focus for us is to modify our behavioral health rules so that we can provide more services. You
think in this next legislative session you have got the ear of legislators now and there will be a funding commitment to this?
Yes, we have had tremendous support. Tremendous support from the governor, tremendous support from the legislators. We have legislators who are giving us significant amounts of their own personal time in order to really, not just sit at the sidelines and say, how are you doing, but actually get in there, roll up their sleeves and work with us. And they are very committed, not just to supporting us in the legislature, but to supporting us back in their home districts.
Right.
And a lot of this is not something government does alone. That's the other thing, right? This is something, when you start talking about societal issues, this is something we all have to work on. And they are very much partners with us in that way.
About 30 seconds here before we have to take a break.
Sure.
Will the results of these new efforts eventually that will get put in place, will it be just a decrease in the numbers of the children that we see in the statistics, or will there be another measurement or other measurements that you'll be looking at?
We're going to measure quite a few things, not just, the overarching is, of course, is to measure the number of children you have to take into care, but we also want to measure whether or not children come back into care, how long they stay in care, do we have them in the right placements, Are we able to keep children, when we do have to take a child, we are, for example, we are prioritizing putting the child with a relative where we can do that safely. So we're going to measure that. Are we able to get them with a relative? Are we able to keep them in their school district? Are we able to keep them as much as possible in their own community?
Right.
So we have a whole series of measurements that we're going to be judging ourselves by, and really striving to achieve those, because it's better it's better for Arkansas, and it's also better for the child.
All right, we're going to take a quick commercial break. We're going to come back and talk some private option, Arkansas Works, Medicaid expansion, whatever you want to call it.
Sounds great.
Our guest is Cindy Gillespie. We will be right back right after this. And welcome back. I'm Roby Brock. We are with Cindy Gillespie. She is the Executive Director of the Department of Human Services. Let's talk, shift gears, talk about Arkansas Works, formerly the private option. I guess it's still technically the private option. Well, we won't get into the semantics on that there. In mid-October, it was reported that the state's Medicaid expansion population for either enrollees or eligible was over 300,000. You said it was likely to grow. Why is it growing?
Because we are clearing out our backlog of Medicaid cases. So one of the things that's going on right now, you may remember back in May or June, I believe, we pulled together the details on the backlog of cases that were out there, people who had applications, changes, renewals that hadn't been processed. We had over 140,000 of them. And the governor and the legislature gave us some resources to tackle that, and our incredible team at DCO has been working on it since then. We're now down with the goal of clearing it by the end of this month.
Oh, okay.
End of 2016. We are now under 25,000 cases. They have processed over 100. It's amazing the work they have done.
How high do you think that population grows to?
Our hope is it's not going to grow that much more from here, and then as we complete this effort, so what we've got is a backlog of cases that we're going back as far as 2013, right? So as we complete this, several things happen. We will start a whole series of efforts then to, I guess you would say, make sure not only that going forward we are current, but that we're also very accurate in terms of who's in there. With Arkansas Works starting, we'll do a mailing later this month to everyone, and anything that comes back in that mailing, returned addresses, etc., those are people we can go in and take off the rolls. We'll do another one early next year to send out tax forms to everyone. Okay. Same thing. So we've got several things coming that will help us make sure that now that we've processed everybody through, we're able to actually get the rolls accurate. One
of the things that we have talked about a lot just on the business front here, and this may be too simplistic of an approach, but unemployment is low, employment is high in Arkansas. We should be seeing fewer people on the Medicaid expansion roll, should we not? Why is that? Explain to me why that logic is there. It's
probably partly because the Medicaid expansion goes up to something they call 138% of the federal poverty level. You've probably heard that referred to. Well, in Arkansas, with the wage scales, you can be a full-time worker and still be under that federal poverty level of 138%. So in other words, we have people that are probably on Arkansas Works who are full-time employees and who may have been on an employer's insurance before private option came into place. And I think that's part of what you're seeing here.
Let's talk about potential changes. I think this coming week, Governor Hutchinson takes a trip up to Washington, D.C. and learns a little bit more about what may transition with the new administration. What are your expectations? What do you hope will be different from existing administration policy?
I think we're all extremely excited here in Arkansas and in the states in general that what we are going to see is a return of power to the states. We're going to see, we have been facing for several years now, piece by piece, control shifting from here to Washington, D.C., and we think we're going to see flexibility returning to the states.
Some of that will be block grants?
It could be in the form of what people call block grants, capped allotments, all kinds of different forms. But what it means is flexibility. At the end of the day, what it means is we should be able, as these changes come about, to decide more about, well, that 138% of federal poverty level, for example. Do we have to go all the way up to 138, or could we just go to 100? Could we go to a lower number so we don't capture full-time workers?
Is that necessarily good public policy, though, to not have, I mean, to have that much variation between states there, to not have some sort of consistent national policy on that? I get the flexibility aspect.
See, I personally believe that states, I personally believe those decisions belong in the states. As somebody who worked in Massachusetts, right, and now works here, I can tell you that it is a completely different economy in Boston than it is in Little Rock. And that what you do for Massachusetts is not the same thing you should do for healthcare in the Delta. Really?
Yep.
It's two very different worlds. So
good point.
State flexibility is the key.
All right, I got to wrap it up there, but if you'll stick around, we'll do a little bit of a web extra for our online version. All right, Cindy Gillespie with the Department of Human Services, thank you so much.
Thank you.
And welcome back to this web extra. I'm joined by Cindy Gillespie. She's with the Department of Human Services. We ran out of a little bit of time on air there, so we're doing a little bonus round with you here. Representative Tom Price is going to be the Donald Trump's HHS Secretary nominee there. He still has to get through his approval process, which is not a guarantee. Sure. You know Tom Price, though. Tell me a little bit about your experience with Tom Price.
I always think of him as Chairman Price, so it'll be interesting to call him Secretary Price. He's, as you know, a Georgia congressman. I am from Georgia originally, and he's also a physician. And I met him initially working on some issues in Georgia, but then he became very serious about developing an alternative to the Affordable Care Act, an alternative to Obamacare. And so he is one of the few who has actually developed a very comprehensive repeal and replace plan. And I did get to know him and work some with him as he was working on that legislation. An extremely thoughtful person. He's a physician, so he thinks in terms of what policy is going to do to the delivery of the actual delivery of health care. But he also, I found him to be extremely, something I really liked. Coming from the rural South, he understands that rural healthcare needs are different. And he really looks to give states flexibility, give states option. And he also focuses very heavily on things that we like. Letting a state do work requirements. How do you use healthcare to incentivize people to take advantage of work opportunities, education opportunities, those sorts of things. Yes, I think you'll see him as someone, judging from his legislation the way he's always been, someone who wants everyone to have some sort of ability to get health care and health coverage, but he doesn't believe that Washington should dictate how that gets done. Right. And he does believe very much in individual choice around it.
Well, and he's talked publicly about HSAs, he's talked about tax credits.
Exactly.
Good policy ideas.
Very good policy. To me,
some of that stuff is very difficult sometimes to manage.
It is, but to me it's very good policy ideas because when he talks about tax credits for health insurance, he, quite bluntly, is not talking about individuals getting a tax credit in order to buy health insurance from the government. He's saying, all right, if people at a certain income level, instead of us saying you must go buy this policy through this exchange that is the policy we set up for you, he says, we'll give you a tax credit, you buy your own policy, you pick your own health care needs. And
if somebody doesn't, well, they have to buy the health insurance to get the tax credit is the bottom line.
Exactly.
So they may choose not to buy health insurance, though.
And then not get a tax credit.
That doesn't help with coverage, though, does it?
And again, he comes from a standpoint where, like I said, he does believe that the individual gets a choice in the matter, and not that Washington should be dictating exactly what everybody should do and buy.
Also, too, he has talked too about federal money for high-risk pools, and that is obviously a very difficult segment of the population to find coverage. I think, too, there's been discussion, I don't know if Representative Price has been the one driving this, but there's been a lot of talk about, kind of delineating state lines there and not having that as something that is an obstacle. Do you support that?
I think it's something that if Arkansas gets the flexibility to to be able to look at all of our programs with these changes coming. I know it's something that we'll all look at, how those areas could work. Again, it comes back to being very state specific. I don't think you will see him and the Republican Congress saying you must do it this way, but instead saying, all right, here is an option for states, if it works for them, to be able to develop a high-risk pool, put parts of the population or parts of those bills into that risk pool. Yep. So if we go down a road here of getting the flexibility to really look at our Medicaid programs and how we're delivering them, you know, those are all ideas that are on the table to be looked at.
And Arkansas does have a national reputation, you and I've talked about this before, as being on the cutting edge of some of this activity. Do you think that the federal government will come to Arkansas and ask for more input in terms of what's going on?
I know they will. They already are.
They already are?
Yes, yes.
Well, you could share a little bit with me on that.
No, I mean, no, it's just, you know, Governor Hutchinson, as you know, has already been, he was elected, I think it was 2 weeks ago, to be vice chair of the Republican Governor's Public Policy Committee. The RGPPC is where the Republican governors come together to develop health policy. So he's already looking and working on developing national health policy ideas, which will be brought by the Republican governors to the Republican Congress and the new Republican administration. So through our governor, as well as through a lot of the other efforts, Arkansas is going to have a big voice.
Sounds like more travel for you too, possibly.
A little bit more for me, but
right.
Looking forward to it.
The web extras always get more into the news than sometimes the on-air conversations do. Cindy Gillespie, thank you so much. Appreciate you.
Thank you.
So, all right. And thank you for watching. You can keep up with the latest business and political news each and every day at our website at talkbusiness.net.